Let's talk about labs and pregnancy.
That much blood.
I'm currently 25 weeks pregnant, and I want to go over all of the labs that they did for me in the first trimester, the second trimester, and also talk a little bit about all of the genetic screenings that they did as well. So, when I first went in to my OB, like my first OB appointment, they put in some labs, and I went down and did those labs, and they literally pulled like, I don't know, like 10 tubes, it seems like, if I can remember correctly. I took a little video of it. I'm pretty sure that all of those labs that they did initially were for the NIPT, which is the genetic screening that also will tell you the gender of the baby. I was so happy that this test was offered to me early because we really wanted to know, like, as soon as possible what the gender of the baby was going to be. But the main reason that they do this like blood screening is because they want to screen for chromosomal abnormalities. So they'll use this test to find out if the baby has like Down syndrome, Edwards syndrome, or anything like that. Generally, they can't do any of those blood tests until you're at least 10 weeks because after 10 weeks is when there's enough what they call like fetal DNA in the mother's blood to actually detect some of those abnormalities. When they do this genetic screening, they're going to screen for trisomy 21, trisomy 18, trisomy 13. They're also going to look for Turner syndrome, Jacob syndrome, something else called XXX syndrome, and then one other one that I can't pronounce. They're also going to do what's called a cystic fibrosis panel. And then the most exciting part is the fetal sex. They're also going to screen for like every disease possible. They're going to run screenings for Hepatitis A, Hepatitis B, Hepatitis C, and just see if you have immunity to any of those antigens as well in your blood. They'll also look at your immunity to rubella and varicella. Usually, if you don't have immunity to rubella and varicella, then they'll just have you go to like an immunizations clinic or wherever you usually get your vaccines. And you'll get a shot that helps you to become immune to rubella and varicella. They're going to do an RPR, which screens for syphilis, and then they'll also test for HIV and do a GC, which is a gonorrhea chlamydia screening. The last like genetic type thing that they screen for in your blood in those initial labs is spinal muscular atrophy. It's called a spinal muscular atrophy report. I have seen mothers with hepatitis B and giving birth, their baby has to actually get a vaccine for hepatitis B. And it's not just like the normal newborn vaccine that you're thinking of. So we do give a hepatitis B vaccine, vitamin K for blood clotting, and then the erythromycin ointment in the eyes that babies get like right at birth. But mommies who actually have hepatitis B in their blood, the baby has to get an extra vaccine, which has like hepatitis B immunoglobulins in it. I'm just going to read this to you real quick. So it says, infants born to an HBsAg positive woman should receive HBIg and a dose of single antigen hepatitis B vaccine less than 12 hours from birth, followed by a complete series of hepatitis B vaccine, which is up to 94% effective in preventing perinatal transmission. I'm a labor nurse, so I do, and I have seen this. Like, it's not uncommon. It doesn't happen a lot, but it's not uncommon for this to happen. And then with all these labs, they're also going to run like a basic CBC, which is going to have your platelets. Platelets are so important in pregnancy because if your platelets are too low, there can be something way more serious going on. And not to mention, if they get too low, then the anesthesiologist will not do your epidural. Usually, if your platelets go under 100, they start to get a little bit worried. And I've seen a lot of anesthesiologists who will not do your epidural if your platelets are under 80,000. The CBC looks at your red blood cells, your white blood cells, and your white blood cells are usually a little bit elevated in pregnancy because naturally your immunity is just a little bit lower in pregnancy, so your body doesn't fight off baby. And then that CBC is also going to look at your hematocrit and your hemoglobin. It's pretty common in pregnancy for women to get anemia, and the doctors will look at your hemoglobin and your hematocrit levels just to see if you're anemic or not. If that happens in pregnancy, which is pretty common, I actually see this quite a bit, maybe like 25% of women, the doctor will put them on an iron pill, and they'll usually take it like once or twice a day in order to see if they can get that anemia to resolve. If that does happen and you do have low iron in pregnancy, it just might mean you're not eating enough foods with iron in them, or it could mean that your body's not absorbing it. So iron needs vitamin C in order to be absorbed. So it can help if you do have anemia to take your iron with like a little bit of orange juice. The main foods that are going to have a lot of iron in them are like dark leafy greens, meat, poultry, fish, beans, stuff like that. Okay, let's take a look at my labs. I'm just going to read them to you. My white blood cells are at 6, and the reference range is between 4 and 11. So white blood cells were normal. Red blood cells, they were at 3.9, so almost 4, and the reference range is 3.8 to 5. Hemoglobin was a little bit low, and so was hematocrit. My hemoglobin was at 11.6, and the reference range was 11 to 15. Now, it is low, but was barely low. And so I just reached 25 weeks of pregnancy. I had my 24-week appointment last week, and they actually put in for labs again, which I'll tell you guys all the labs that they want me to do at 24 weeks after this. But the doctor mentioned, he was like, okay, you're right at the cusp of low. So they're not really calling me like anemic, but they said that as pregnancy goes on, it's more likely that like the hemoglobin and the hematocrit are going to continue to drop. So they're probably going to start watching me pretty closely. And that's one of the labs that I still need to do coming up that he put in for at my 24-week appointment. Hematocrit was 34.6, and the reference range is 35 to 47. My platelets were 258,000, and the reference range is 150,000 to 450,000. And then here's the hepatitis panel that they did. So you can see they'll look at the surface antigens and see if you have immunity or not. So hepatitis B, surface antigen, hepatitis C, antibody, hepatitis A, antibody, and hepatitis A, hepatitis B, core antibody, and then down below they do the RPR, which you can see was non-reactive. And then here's all the genetic screenings. So it'll literally like list it out. Trisomy 21, Down syndrome, is negative. Trisomy 18, Edwards syndrome, is negative. Trisomy 13, I don't know how to say this, but I think it's Fetal syndrome, is negative. And then the fetal sex will be here. And if you don't want to know the fetal sex, then you don't open that lab. But if you open it, it'll actually make you open another screen on my portal. And that way you don't accidentally look at the gender if you don't want to see it yet. And then it'll list out like all of the syndromes. So Turner syndrome, it'll look like at the X and double Y chromosome, which is Jacob's syndrome. And then 2 X's and a Y is the syndrome that's listed there that I don't want to embarrass myself trying to pronounce. And then they'll look in and see if there's like 3 X chromosomes, and then that would be the XXX syndrome, which you can see all of them here say not detected. They're also going to look at your blood type, which you can see my blood type is O positive. It's listed here. I have a positive IgG rubella antibody, which I'm going to explain what that means right now. So having a positive IgG antibody to rubella, it says positive sample is considered positive for the IgG antibodies to the rubella virus. So that basically means that I'm immune and that It's because I've had the varicella rubella vaccine because I'm a healthcare worker. So we're required to be vaccinated for that before we can actually work in a medical facility. And then you can see they do an HIV screening, and non-reactive means negative. You can see the gonorrhea, chlamydia, which both say non-detected. And then these are the other genetic screenings that they do. So the Cystic Fibrosis 39 Variant panel report, and then the Spinal Muscular Atrophy report. And then they'll do your blood pressure and heart rate, vital, like basic vital signs. So those are all the basic labs that they did initially, like at the 10-week appointment at the initial OB visit. And then recently, when I went back for my 24-week appointment, which was last week, they put in for another RPR, which is screening for syphilis. And they do that 3 times during pregnancy. They'll do it at your first OB appointment, maybe again towards the middle of pregnancy. For me, at my office, they routinely do the RPR again at the 24-week visit. And then usually I see them do it again at like the 36-week visit towards the end of pregnancy. And then the other lab that everyone is talking about is the gestational diabetes screening. And so that, for me, was put in at 24 weeks. If you have a history of diabetes or you're having like symptoms of gestational diabetes, then sometimes they will put in that lab early. But routinely, it's done between like 24 weeks and 28 weeks of pregnancy. And that's going to be like the 1-hour glucose screening. So that's the one where they will draw your blood, make you drink a sugary drink, draw your blood again, and then it has to be under a certain amount for you to pass. I actually haven't been down to the lab to draw any of those labs yet because I still hadn't filmed this video from like my initial labs at 10 weeks of pregnancy. I've just been pushing it off. And so I'm finally filming this. I wanted to film this first, and then that way I can go, and when I do my 24-week labs, I can film like how the gestational diabetes screening goes and kind of like take you guys along with me doing that screening. And then the last thing that they put in at my 24-week appointment was another CBC, because he wants to see, of course, if I have anemia, because initially I was just like I was a little bit low, but just like right on the border of possibly having anemia. And he said generally it continues to get worse, like the farther along you are in pregnancy. So those are the basic pregnancy labs that they run at the 10-week appointment, and then all of the results, like how to read them and just what to expect at your first OB appointment, like what labs are they going to run. Another genetic screening that we did was the nuchal translucency, which can be done between 11 and 13 weeks of pregnancy. And that is where you go and you do an ultrasound, and they measure the fluid behind baby's neck. And there's other things they do as well to see if there's any genetic abnormalities. So if you're interested on information for the nuchal translucency, then follow along for that video. I'm going to put together everything, like going through the journey of actually getting the nuchal translucency ultrasound done and what to expect. I'll try to put a card for that video right here, and then also it'll be in the description below. Let me know if your OBGYN did any additional labs that I didn't mention here for your routine OB visit. And I will see you guys in the next video. Bye.
Okay. These yet?
I come in before my appointment.